putting the X in success, reducing absenteeism and helping employees stay healthy with Pluxee UK's Jonathan Bedford and Doctor Care Anywhere's Dr. Olivia Codrington.
Welcome everybody. My name's Jonathan Bedford and I'm the Merchants and Partners Director at Pluxee UK. I'm delighted to be joined today by Dr. Olivia Codrington, a lead GP from Doctor Care Anywhere. And together we're going to put the X in success with the first of our podcast series for Pluxee UK. Olivia, welcome. Thank you very much for joining us today.
Thanks for having me. Looking forward to our chat.
In terms of what to expect from today's pod, we're going to be discussing the growing need for businesses to look at enhancing the healthcare solutions that they provide to their employees. We're going to look at sickness absence and the impact that that has on firms. We're also going to talk a little bit about some of the pressures mounting on our health service and also introduce our brand new digital healthcare platform, Online GP, delivered of course in partnership with Doctor Care Anywhere, which is an inclusive benefit and available at the fraction of the cost of private medical insurance. So I thought in terms of setting the scene, a good place to start would be to talk about the current challenges facing our National Health Service. And no doubt many of our listeners will have seen multiple headlines in the past couple of years in particular talking about the fact that our NHS seemingly is in crisis. There are also plenty of stories from lots of different people across the country talking about the increases in waiting times for certain operations and procedures, and seemingly from time to time it looks like demand outstrips supply when it comes to the provision of certain services. And when I was doing my research in the lead up today, I saw a stat which was quite damning that actually said that 26% of patients had to wait over a week to see their GP, which clearly is really challenging for us. However, when we looked at online GP data, 100% of people were able to book their appointments within 24 hours, with 96% of people able to actually see a GP within 8 hours, which is phenomenal. Olivia, could you talk to us a little bit about the ways in which you're able to support the NHS and support employee wellbeing?
So in terms of supporting the NHS, we are all GP or advanced nurse practitioner clinicians trained by the NHS, and we all still work within the NHS. We know better than anybody the constraints that are currently available. However, we want to deliver excellent standards of care to our patients in a timely fashion. By being able to work doing online GP with Doctor Care Anywhere, we can then get that satisfaction that we want from our jobs as well, in supporting patients, in providing continuity of care and developing like longer standing relationships and looking after people to deliver a longer standing well-being that they aren't getting from their GP at the moment, because it's so hard to A, access the same GP each time you call into a surgery, and B, you can be waiting for weeks. I'm actually surprised the numbers aren't higher in terms of the waiting times for over a week.
And did different geographical locations play into that? You hear a lot in the press about postcode lottery when it comes to healthcare provision.
I think although GP services within London, for example, and any major city will have a lot of patients within each surgery, it's actually in rural areas that it can be a problem. Surgeries like lying empty, with no GPs wanting to move to those areas to fill them. So this is another way that digital healthcare can mean that we are eliminating a postcode lottery from that point of view as well.
It certainly seems that you're providing a service. Whilst there is no panacea here, it's definitely something that's going to take the pressure off the NHS, support them.
Absolutely. We know that if a patient comes to see us and we have a referral pathway that we can utilise, it's removing some of the pressure from the NHS so that patients who don't have access to an online GP or private medical insurance can then hopefully make use of the NHS service more quickly.
And if I had a particularly sensitive issue and I wanted to see a male doctor, or maybe a lady would like to see a female doctor, is that something that you can support?
Absolutely. You can choose your clinician by gender as well as by name or by whether they're a GP or an AMP. That's certainly something that we can do. And we want to maintain patients' dignity. We want patients to feel comfortable in being able to open up to us.
Yeah.
It's interesting, actually, you can break down the barriers of speaking through the laptop quite quickly. The non-verbal communication that we're so used to using in a GP surgery, you can still convey that you care and that you want to help somebody, even though you're not sat face to face.
And with online GP, with your service in particular, are there any USPs? Is there anything that you provide that isn't available via other providers in the marketplace?
So as I said, we're the only provider that allows you to still be registered with your NHS GP practice while still making use of our service. Our appointment lengths are longer than some of our competitors.
Okay.
And we have both GPs and AMPs, which allows us to be able to offer appointments in a more timely fashion.
So it's a really comprehensive service.
Yeah.
So look, it's really clear that there are loads of benefits for employees. And I know from first-hand experience, the last time I used the service was in the summer. I had a bit of a chest infection.
Yeah.
I couldn't see my doctor, unfortunately, for a few days. I was actually able to get an appointment later on the same afternoon.
Fantastic.
I was able to get my medication later on that day, which obviously then sped up my recovery and meant that it didn't impact my life. And obviously from my employer's perspective, that's beneficial for them as well. The other time that I've used it was with my children. There have been a couple of times where I wanted peace of mind, and actually, you can't put a value on that. So I think it's a wonderful service.
We are 24 hours a day, 365 days a year. So even on Christmas Day, if you have a concern about yourself or one of your family members, there are appointments available. So you can access us at any time.
I have to say, as an employee, being able to access that service, it really gives you peace of mind. So I think that's fantastic. Yeah. But actually, it's not just employees that benefit from the service. Of course, there are many benefits for the employer. Whilst there is a per capita cost for the service, increasingly employers are seeing this as an investment in their people rather than a business expense.
Completely.
I remember I was reading the stat that said that typically an employee, when they're going to see their GP, would have to take half a day off work, which will impact productivity, it'll impact business output. When it comes to supporting employers with tackling absenteeism, which I know costs our economy so much money each year, how do you see online GP supporting employers on that front?
As somebody who has also used the Doctor Care Anywhere service, I can organise my day, be in meetings as planned, and then for a 15-minute appointment, I know I can just block out what I'm doing and just change onto a different platform from Microsoft Teams onto there. I can explain what my concerns are and then get the treatment that I need. And then within minutes, I'm carrying on with work. Whereas, I don't know about you, but if I ever have to go to the doctor in person, I don't just sit at my desk until it's time to walk out the door. There's other things that you're doing and getting distracted by and whatever else. And so you can see how you can easily lose half a day of productivity because you can't get in flow, can you, to get on with your work?
Exactly.
If you know you've got to get up to get to the GP, you could then be waiting for half an hour or more. And I don't say that in meaning any disrespect. I'm a GP as well, and I've kept patients waiting that long. Because if there's someone that's clinically more urgent in front of you, then you're not going to hurry them out to get the next patient in just because they've got to get back to their desk.
And then, of course, there's presenteeism. I saw a stat saying that 30% of people couldn't book the requisite time off that they needed to actually go and see their GP, which is an incredible stat. How do you see online GP supporting on that particular topic?
Because we work 24 hours a day, 7 days a week, 365 days a year, if you don't have an urgent problem, but you have something for which you'd like to get a referral or non-urgent treatment, then there's no reason that you can't do it when you finish your working day. We have a number of patients that are shift workers, and so it might be that they're accessing our care at 4 o'clock in the morning, or there is appointment availability there no matter when your hours of work are.
And I would think that helps with anxiety, where people are maybe slightly anxious around trying to get the time off that they need. They've got deadlines, they've got pressure on certain projects that they're working on, whatever the reasons might be. That peace of mind knowing that actually they can get the support that they need without impacting their working week, I'm sure, would be a real fillip for most people.
Yeah, and you've said you've got children, I've got children as well, so it's not just us, it's our kids as well. We may have parents that are unwell. So when you start factoring in all the different people that need appointments, that's quite a lot of time away from work, and it could eat into annual leave as well, cause bad blood with an employer. And actually, by having a service like this, it's showing your employer cares about you, but equally wants something to be dealt with sooner before you become more unwell and start worrying about other elements of your job and how you come across as whether you're invested in your company or not.
And then we talk about the employee value proposition and from an employer's perspective, where they're looking to boost that EVP. Do you think that having a service like this in place would help with things like employee retention and attracting talent to the business?
Absolutely. Now that I have it, it's one of those services that if I were to work elsewhere, don't worry, I'm not going anywhere, Dr. Clare, anywhere. If I were to work elsewhere, I would want a similar service because I'm so used to it now, and it just makes my life an awful lot easier.
So you think it's almost become a hygiene factor in terms of people's expectations in the modern workplace now?
Yeah, absolutely.
Okay.
Absolutely.
Okay. Then, of course, there's the issue around inequality when it comes to healthcare benefit provision. In the many years I've worked in this industry, more often than not, the go-to, the staple for most businesses when it comes to healthcare tends to be something like a private medical insurance. However, that's typically offered to the upper echelons of the business, senior leadership team and above, as opposed to it being something which is offered right across the board. Whereas with online GP, of course, it's offered to everybody, from top to bottom, from bottom to top. From your perspective, do you feel it's something that can help with tackling that health inequality divide?
In terms of health inequality, if we're thinking about patients with their NHS, we've already spoken about the postcode lottery, but then to know that no matter whether you are a new trainee in a shift work role in a warehouse or you're in the C-suite, you have access to online GP. To know that you have that gives peace of mind for all, and I would have thought would make the company feel more together and more cohesive because it's not valuing some people's healthcare over others. We're a service that's available 24 hours a day, 7 days a week, 365 days a year. We have clinicians on the platform in the middle of the night. You've always got someone you can speak to. Our appointments are up to 20 minutes each. We can issue prescriptions just like your GP surgery can. They're delivered straight to your phone. You can take it along to your local pharmacy to pick up your script.
Super.
Or you can have it delivered to your home or to your place of work. So that makes life easy from that point of view. On the Dr. Care Anywhere app, we have another function in addition to being able to see a clinician, in that we've got the My Health Wellbeing tool. You can receive help to do with sleep, mood changes, exercise advice, relationship advice, and it's an additional tool that employees can make use of if they don't feel they need to speak to a clinician.
And surely, you'd get a big engagement boost off the back of it being very much an inclusive benefit from an inclusive employer.
Yeah, and I think quite a lot of companies that already utilise the service, their employees state that it's their favourite benefit and their most used benefits in terms of what their company offers to them.
It's growing in popularity all the time.
Yeah. So I think we had 2.5 million patients a year or two ago. Given that we do 70 to 80,000 appointments a month now.
Wow, that's crazy.
We've easily surpassed the 2.5 million.
I think one of the best thing about it is that it supports our NHS. Most people love the NHS. Most of us know many people that work for the NHS. You, of course, do yourself. And actually, anything that supports those people who we all stood outside and clapped during COVID, they're heroes. And if this service takes some of the pressure off them and supports employee wellbeing, it's got to be for the better of everybody, surely.
Completely.
Yeah.
There's obviously a finite number of doctors within the country. Many of us do both NHS work and private work. So it's not even as though our doctors are choosing to work for Dr. Care Anywhere over the NHS. It's on a different day or an evening or a weekend or overnight. And so it's not taking away from that system at all. It is very much there to support it and relieve some pressure.
I'm going to change gear ever so slightly now and put myself in the position of an employer who's maybe scanning the market and looking at options in terms of how to do more for their people on the employee wellbeing front. So I'm sure that there are plenty of questions around, okay, what does it entail? What would I need to do in order to set the service up? So typical questions might be something along the lines of, would the service differ versus the service I'd receive from going to see my GP myself?
Absolutely not. We pride ourselves on having GPs that genuinely care about their patients. They come to work for our service because they want to be able to dedicate longer to their patients.
Excellent.
And feel as though they are actually making a difference.
Okay.
So it's important to remember, from the assessment to the treatment given, it is no different to the standard of care that you would expect in the NHS. There's just longer to do it, so you actually have time to develop a relationship with your doctor or AMP compared to feeling hurried, for example.
Again, there's a huge benefit to the service. What about the provision itself? You know, people can present with a myriad of different ailments. Are you able to cater for every type of requirement?
Yeah, so when starting the booking journey, you can choose your health concern by part of the body.
Okay.
And from your head to your toes, you can choose an issue. You're then asked some questions that will help direct the patient as to whether this is something that we're worried about. You actually need to be seen face to face now, i.e. go to an urgent care centre or A&E. Or in most of the cases, it isn't something that is urgent. You must be seen within the next hour or so. So you answer the questions. That then helps as well with information gathering, which gives you longer to have that time with your doctor or your AMP to talk through your symptoms in your own words, explain what your concerns are about it, what you're hoping to get from the service that day, and ask for any additional information or guidance about what might help speed up their recovery.
When it comes to data, so employees no doubt will be providing information to the GPs via the service. How is that data used?
You have a set of medical notes on a fully encrypted platform. You are able to give us consent or withhold consent for us to share your notes with your NHS GP. Obviously, if we are given consent to share your notes with the NHS GP, that then allows your NHS GP to have a full health record for you.
Of course.
But if it is something sensitive that perhaps you've seen your GP for and you didn't like the advice they gave you, so you've sought a second opinion but you don't want them to know, then equally that's fine as well. You don't give consent to share the notes with the GP. It just stays on our platform and is safe.
So in terms of your practices, you're fully compliant with GDPR policy?
We are, yes.
I also wanted to ask you about the service across multiple sectors. So as an employer, if I'm looking to bring this service in for my employees, whether I work within the logistics industry and I've got drivers out on the road all day, I've got office workers, or I work in the manufacturing industry and I've got people on the production line, people working in warehouses, I'm assuming the service is available for everybody and they can access the service to suit?
Absolutely. So all you need is a smartphone to be able to have the Doctor Care Anywhere app, a quiet space, and 20 minutes of your time in order to speak to your clinician. We already have people across all sectors working. So I have done consultations with delivery men that have pulled over to the side of the road. They're in a safe, quiet space. We can do the consultation
Healthcare
as normal.
on the go.
Exactly. And then other people in a warehouse that have just gone out into the corridor to have some privacy while they speak as well. So it really is something for everybody, not just for office-based members of staff.
Olivia, thank you very much for joining us today.
Thanks for having me. I've really enjoyed it.
Join us next time to discover how Pluxee UK is putting the X in success, enhancing employee engagement and making life at work more joyful.